Hi, everybody. Thank you so much for coming here today to the Meno Café to be with Stripes Beauty and all of these incredible women. We are thrilled to have you. I'm Cara, Kamenev. I'm the president of Stripes. And I will quickly introduce our panel, but I just first want to say that we're going to have an amazing conversation today. We're going to talk about sex and intimacy and midlife. And you are in the one place in all of New York City where midlife is not a crisis, it is a celebration. So we are here to celebrate, have a coffee, and please stay after to shop the brand because we're also selling. This is our first store, our first real expression of the brand where we're bringing together products and expertise and coffee and a little bit of humor. So thank you again all for being here. And I will now introduce the incredible women from whom we're going to learn and converse and commiserate. So first we have our founder, Naomi Watts, who needs no introduction. And then our advisory board members, Dr. Cindy Meston and Dr. Somi Javaid. And then Dr. Jennifer Peña. So I will try to do my best to give a little bit of background on each of these women so you can understand kind of who you're learning from. But I'll start on the far end with Dr. Meston. So Dr. Meston is a professor of clinical psychology and the director of the Sexual Psychophysiology Lab at the University of Texas at Austin. So it's one of the few laboratories in the world that's devoted exclusively to the study of women's sexual health, woohoo, from both a psychological and physiological perspective. And she received her PhD in clinical psychology from the University of British Columbia, has 2 consecutive postdoctoral fellowships in sexual medicine, and is an all-around badass, I believe is the technical word for that. Then we have Dr. Somi Javaid, who is a board-certified OBGYN surgeon and a Stripes advisory board member. She's also the founder of HerMD, which is a healthcare platform transforming how women experience care in menopause. She can speak to some incredible things that she's done in the fundraising and the VC space, which takes its own set of things we don't have. And she's also been named to Fortune's Most Powerful Women, Worth's Groundbreaking Women, Inc. Female Founders. She's an incredible speaker, an incredible asset, and a great friend of the brand and of all of ours. And then we have Dr. Jennifer Peña, who MD, FACP, I'm going to butcher all the titles, but she's a board-certified internal medicine physician and the chief medical officer at Wisp, which is also an incredible partner for Stripes and one of our new brand partners, which you should all check out. And she has over 20 years of experience spent in clinical practice, military service. She's a veteran, health technology, executive medicine, and she is an Army combat veteran and a former White House physician under both the Obama and Trump administrations. So when I say that we've brought the best in expertise and conversation together, I really mean it. So with no further ado, let's talk about why we're all still so hot. Let's talk about sex in midlife and menopause. I'm gonna flip my page. So Naomi, I'm gonna start with you. We call this panel Still Hot for a reason. Menopause is often framed as an ending, but for Stripes, it's about confidence, desire, and redefining yourself. So tell us a little bit about why you created Stripes and why we're celebrating midlife.
I think I created Stripes because I went into early menopause and felt very alone, very scared, and very much in my industry, ageist industry, it was considered very taboo. It turns out every industry was not really interested in the menopausal woman. She did not feel like she had a community. She did not feel like she had product solutions and not prepared for this time because there had been no conversations passed down through generations. So this was a scary and panicky time for me. And I kind of had to piecemeal my way through with a not very active internet because I started at 36 years old and very limited information. So I created a brand because I wanted for a woman to feel organized from scalp to vag, hydrated, in other words, with products, as well as supported with a community and a education, a robust form of education that's evolving day to day. And this brand is about hope, it's about answers, it's about keeping your confidence, not feeling left out, you're not done. It's absolutely not the end. I feel I've done things for the first time in my life in my 50s. I wrote a best-selling book. I developed a company, and I got married for the first time. I'm not saying that's what everyone will do, but it didn't feel like that would ever be possible, because I thought once you're over 40, you're over the hill, because that was the societal message that was being passed on to me. And so the brand was created with that in mind, that I wanted a woman to feel supported through product solutions and community and education.
Amazing. And we're all so grateful. I think even in the short few years since the brand has been founded, we've made so much conversation as a culture and society, and it's starting to happen. I think we're seeing like the groundswell of information and conversation, and we're coming out of the silence and the stigma, and we're saying, no more, not enough. We deserve and demand a bit more. So Dr. Peña, why do you think this stage of life has been underserved for so long in beauty and health and wellness?
Just to piggyback of what you said, we were just talking about having a menopause commercial on the Super Bowl. How fun would that be to follow the erectile dysfunction ones? That would be powerful. You know, it's because we've been invisible, honestly, right? I think we all feel that, and we all know that. I think part of it is our own society. We live in a society that cherishes and celebrates youth and fertility, and when you get to menopause, it's like you've expired. Your shelf life is done. You're dead, right? I think it's really fascinating because we're talking a lot about longevity, and that's like the big thing. Everybody's talking longevity this, longevity that, but menopause is a critical point in a woman's life that actually dictates longevity. It dictates how well you're going to live and how long you're going to live. So that's the key to longevity. Every time my patients ask me, I'm like, let's talk about your menopause, right? Forget all these supplements, forget all the biohacking. That's what you need to take care of. So again, I know you've probably heard this already from these experts, but 40% of your life as women, you're going to spend in some degree of peri or menopause. Over 1 billion people estimated to have, menopause in 2030, but less than 2% of research dollars being spent studying this exact same thing. That's critical. So I think it has been a tragedy, but I have the easy button on my desk, right? The Office Matt's easy button. I think we have to hit that reset button and start a new narrative.
Yeah.
Well said. Dr. Javaid, you said women's health is decades behind where it should be. Why has menopause in particular been left out of the mainstream medicine conversation for so long?
Because up until now, menopause has not been considered sexy. It's been considered shameful or full of taboo, but women weren't included in clinical research trials. We had no funding, either VC or research dollars. We spend 4% of research dollars on women from head to toe, scalp to vag, and 2% on the prostate, which is the size of a walnut. That's ridiculous. Get mad for a moment, right? Lack of female leadership and lack of education. The reason you did not know anything about your sexual health care beyond babies and contraception and infection is because your doctors didn't know either. I'm a board-certified OBGYN. I graduated with zero knowledge about sexual health, about orgasm, arousal, female satisfaction, desire. I learned all of that later. So all of those factors combined have led us really to be invisible patients and left us in the dark.
We're sharing mics like we share information. Thank you. It's very well said. So let's transition a little bit let's get into the sex talk, the realities of midlife intimacy. So a huge part of thriving is intimacy, and yet sex and menopause remain really one of the last taboos. We're going to definitely focus on Dr. Meston here, but I want to do a quick down the line, and I don't even think you need the mic, but as women in midlife, what are 3 words that come to mind when you think about sex in midlife? Or a few words. Naomi?
Intentional.
Yeah. Peña?
That was mine, but I'll give you another.
Sorry. I'm glad we agree.
I'll give it to you anyway. I think exhilarating, because desire doesn't expire. It just becomes exhilarating.
Yes.
barometer, because I think your sexual health is an overall barometer of what's going on with you. When you're ill, think about it, you don't feel like having sex. So I think it should be a vital sign when you go see your doctor.
Such a good point.
My way.
Love that.
Mic drop.
So, Dr. Meston, why do you think sex and menopause still feel so hard to say in the same sentence? And why is it still so stigmatized? And if you need this, I can.
Yeah. Oh, I talk so loud that I'll. I think a big part of it has to do with the messages that have been passed down for so long, right? What we see in advertisements and TV and women's magazines, all the depictions of sex are youthful, perfectly toned bodies, right? You're not seeing pictures of 50, 60, 70-year-olds having sex. And so it gives the message that sex is sexy when you're young and beautiful. And then also many women of, menopausal age were given the messages either from their mothers or their grandmothers or their religious leaders or educators that it's not exactly sex positive, right? It's like sex is dirty or sinful or dangerous, right? You're going to get pregnant, you're going to get a disease, don't have sex. And so by the time a woman hits menopause, she's listened to these messages for half a century sometimes. And even if you don't believe them, you think, oh yeah, grandma was nutty. If you hear those things enough times and long enough, they seep into your kind of sexual schema and become part of your belief system. And so, if you're 60 and you're having great sex, you think, I guess I'm not normal. And if you're 60 and you're having bad sex and want to have good sex, you feel like I don't really deserve to have great sex. I'm 60, I shouldn't be having sex. And then added on to what the doctors have said here, physicians in medical school, there was a paper published not terribly long ago that showed the average amount of training that a GP gets when they graduate from med school is something like 6 or 7 hours. So they are ill-equipped to answer sex questions. You walk into your GP's office, they do not want to talk about sex. They often don't know what to do with you, they don't know how to answer, and they don't know how to refer. So that door is closed. So it all leads to kind of a sense of shame around talking about sex and suppression of communication. There's no open communication. Now, thanks to Naomi and some others, now in the last while, we're talking about sex. So the younger generation, the 20, 30-year-olds of today, they're going to benefit, but the rest of us are a little bit screwed. But
Not in the right way.
Now that's a mic drop.
I love that. No, you're trailblazing for everyone and getting screwed. Dr. Peña, you bring the internal medicine lens. So how do broader health factors like cardiovascular health, energy levels, bone health, or even medications intersect with sexual wellness?
Yeah. I'm also a loudmouth. Thank you, though. The internal medicine perspective is even more limited, right? Because we definitely don't get nearly as much training, but menopause is a condition. I treat it like a vital sign. I treat it like blood pressure. I treat it like cholesterol. When a patient comes in and tells me that they have low sex drive, that's important. We have to pay attention to that because it can be the canary in the coal mine that opens up the doors for something else that's going on. And so, I treat it with much caution, much respect. And in terms of medications, we also, it's an ecosystem, right? It doesn't live in a vacuum. When I give someone a beta blocker, for example, for blood pressure, or even migraines, which we use, right? Beta blockers for migraines. And they're like, my libido is now low because of that beta blocker that you chose. So again, I can't treat it in a vacuum because now it's affecting something else. If I give someone an SSRI for depression, God bless SSRIs. I think they should be in the water system. That's how you make America great again. They actually save lives, right? But 1 in 4 women on an SSRI will complain that their libido is low. And let's not forget the most important part is that menopause on its own is a risk. It's a risk factor for cardiovascular disease. Once we get to menopause, all of a sudden things that we were doing before, we can't quite do, or you will do, understanding that it's going to increase your risk of cardiovascular disease. So I would say, it all lives in the ecosystem of what I do as an internist. But again, the narrative changing, like us bringing awareness to it is important because not to ding on the men again, but like if Viagra had been made for women 20 years ago, we would not be having to have this conversation. So thank you, Viagra.
Thank you. It's so interesting, and we really are a whole person, and there's so much to treat. And I think the word barometer is a great takeaway for me, because it really is. It's a vital sign. It's an indicator. So let's talk a little bit about some solutions and innovations. Dr. Javaid, what are the most common challenges women bring to you around menopause, and more specifically sex and intimacy? And what solutions or treatments do you want them to know exist today?
Yeah, so the most common thing they talk about is sexual pain, usually from genitourinary syndrome of menopause. Your estrogen levels are decreasing. We have estrogen from head to toe. And when there are lower levels of estrogen and testosterone, the walls of the vagina start to thin, the pH goes up, we're more likely to have sexual pain, dryness, frequent urinary tract infections. We can also have sexual pain from other disorders, dermatologic conditions, fibroids. 80% of Caucasian women by the age of 50 have fibroids. So sexual pain is the most common. Low libido. Low libido is very, very common. And that's when we look at the biopsychosocial approach. Is it your hormones? Is it other medical problems that are going on? Is it other medications? Is it because all of a sudden you're taking care of older parents? Or you're sad that your children left? Or maybe you're happy and no one's going to walk in on you having sex. But libido is a big, big issue. There are FDA-approved medications. Pelvic floor issues. Some women develop either hypotonic or a very loose pelvic floor, sometimes a very tight pelvic floor. And so you can get pelvic floor physical therapy. There are lubricants, there are moisturizers. There are problems with arousal. What does that mean? We were all joking that we were getting hot earlier, and that wasn't good. But arousal during intercourse, when you increase blood flow and you start flushing and things start to feel plump, I mean, that's what an erection is. It's a blood flow thing. That's good. That's good kind of feeling hot. So, but some women say they feel nothing or they feel dead. My partner's touching me and I feel nothing. The thing that is maddening to me is that women are told they have no options. There are so many evidence-based approved options for women. We're not quite there with the FDA as men. Men have almost 30 FDA-approved options for sexuality, and most of their problems are erectile dysfunction. Women have about 2 FDA-approved options, and vaginal hormones still, maybe it's changing this week, have a black box warning and say things that it's going to give you endometrial cancer and stroke and dementia. There's not, ladies, ever been a singular study to ever support those claims, and yet the FDA has that on there and has 20-some options for men. And Viagra was fast-tracked in 6 months. So erectile dysfunction was considered a national emergency. Fast-tracked like the COVID vaccine. The first ever female sexual health drug took 6 years. 6 years, and we only have 2 that are currently FDA approved. So those are the issues that I hear from women coming into the office saying, I have no sex drive, and I don't care if it's Chris Helmsworth, Billy Crudup, I'm joking, whoever's in the bed, and they feel horrible because they love their partner, but they're, no matter how attractive they are, they cannot turn on their libido or their spontaneous libido or even their responsive sex drive.
It's fascinating. Only borrowing this because my voice is not strong this week. But so beyond medicine and medications and some of the hormones and the few prescription choices that are available to women, Dr. Meston, beyond medication, what practical steps, lifestyle, communication, mindset can make intimacy more fulfilling during menopause or outside of it, frankly?
Yeah, sure. So first of all, communication. Sexual communication is so important. And in fact, it's one of the 3 predictors of overall sexual satisfaction in women. So by communication, I mean, talk to your partner about sex, not when you're having sex and you're naked and vulnerable, but when you're in a a comfortable, not rushed conversation, having coffee. Because what happens, couples that have been together for a long time, they tend to fall into the same sexual patterns. They do the same things, the same time of day, the same positions. And what worked for you 10, 20 years ago may not be working for you now as body changes, life changes. So open up communication. It doesn't need to be threatening. It can be, you can open it up by, buying a Stripes product, say, look what I have, and open conversation that way, make it fun. Or you can just say something like, hey, we've been together now for 10 years. We've had some great sex. And look, here we are at this stage of life and the kids are gone. We have more time together and our bodies are changing. How should we rewrite our sexual script for the next 10 years, right? So open conversation, make it so that you're on the same page about what feels good and how you're going to shake things up a bit. So communication's huge. Intimacy is huge. And by intimacy, I mean acts of intimacy, which are not necessarily sexual per se. It's all the little things you can do in a day, like, blow a kiss to your partner as they're leaving, a hug, cuddle on the couch, ask them how their day was, and genuinely be interested in hearing. All of these acts of intimacy set the stage, because for women, sexual arousal and desire isn't just when you're about to have sex. It's so contextual. It has to do with what's going on in the day, if they're stressed, if the house is clean, if the dog's been fed, if the laundry's been folded. All of these things distract women from sex. And so acts of intimacy really go a long way in making women feel emotionally connected to their partners, bonded to their partners. And there's a whole body of research that shows, particularly among postmenopausal women, the most important factor in wanting to have sex. Okay, we did a study where we asked hundreds and hundreds of women what makes you desire sex. And out of that, we came up with 4 factors. And the 4 factors were romantic cues, so the candlelight dinners, erotic cues, so that's straightforward, reading erotica or watching an erotic movie together. Kind of what I call evolutionary-based cues, so when you see your partner in a position of status or acting proud or dress well, that's a turn on for a lot of women. And then the 4th one, which is hands down the biggest one, are emotional bonding cues. And that is feeling connected to your partner. We did a second study. We compared pre and postmenopausal women, and postmenopausal women were even stronger on that one. So feeling connected, bonded to your partner is so important for sexual satisfaction in women. And the best way to get there is to set the stage, not just before sex, but that day. These acts of intimacy also play into it. And can I say one more thing? Okay, thank you. I also want to make the point that there's a lot of talk about spontaneous sexual desire, and it really is a misconception in the field that women experience spontaneous sexual desire, because they don't. Men do. Men think about sex more. They fantasize about sex more. There's a closer connection with their genitals. Their genitals are out there. It's attracting their attention all the time. They get an erection. They want to have sex. That doesn't happen in women, with the exception of early on in a sexual relationship, during that infatuation stage when all you can think about is sex, all you want to do is sex. With the exception of that, early in a relationship, women don't think about sex all that much across the age span. And there isn't this spontaneous desire to have sex like we see in men. And that lessens even more as we age. So if you're not feeling like, oh, what's wrong with me? I don't have this urge. I just never really think about sex. I'm just dying to jump on my partner. That's normal in women, so there's nothing wrong with you. It's what's normal for women is more they start in a state of like neutrality, where you can take it or leave it, right? But kind of open. And so if your partner is doing the right things in the day and it's been nice and the context is good and you get a little, neck massage, then women's maybe start to feel a little arousal, and the arousal leads to desire. So it's a different trajectory. In men, you have desire leads to arousal, leads to orgasm, resolution. In women, it's more often the case that they're like, and then they get a sense of arousal and then they desire sex, right? So the message here is, if you're sitting around waiting for lightning bolt to strike to make you want to have sex, it's not going to happen. What you need to do is take charge, set the scenario, communicate with your partner what's going to set the scenario for you, and then be open and receptive to things, and hopefully that will light the spark, and then you will want to have sex.
Yeah, it's spontaneous versus responsive desire.
Yeah.
It's so interesting, this intersection of like the physical, the emotional, the psychological, because as women, we really are like a whole being. We're not just one of these pieces. And I think Stripes also has some products that can help with that, right?
Well, we have, yes, we have 2 vaginal products that were created to tell a woman that if she has this physical support and emotional support, then she can still thrive in this area as well. We have, it was very important to me because I was entering a new relationship in my late 40s and definitely wanted to show up as a sexual being as well in a new relationship, so there was a vaginal moisturizer, which we very proudly called Badge of Honor, because we must honor the vag, of course, and it is a badge of honor. We, as long as we treat her well. And so it's skincare for down there. It's something you can use without intercourse being part of your picture, just wearing tight clothing or exercising, bike riding, horse riding, whatever. And then we have the play oil, which is essentially lube and long lasting. It's oil based. At our age, we don't need to rush through it. Well, sometimes you can do that too, but yeah, it's to speak to the intentionality of wanting this to be part of your lifestyle. It's not over, and just to comment on this, and forgive me, I have a jet lag brain, so I hope I get this right. I feel like sex at this age is, for women, we need the intimacy first before we feel the desire. So that is not just the candlelit, it's the cozy conversations, it's the safety, all of that. But men often they get the desire impulse first, and then they get close, then they get intimacy. So it's sort of how do you get synchronized? And I think being in a relationship where there's safety, there's trust, there's history, and yes, those patterns can get a little dull, but there's just opening up the conversation, getting creative, getting innovative. All the shame just goes out of the window. Open the dirty magazine or phone or whatever, or staycation, whatever it takes to just keep it fresh.
And there's science to support what Naomi's saying. Women are much more likely to orgasm in a boring, known, safe relationship than they are a one-night stand for that intimacy piece that you're talking about. Yeah. And then there's also, with the Stripes products, there's also great apps that you can use. Rosie is a written erotica that's supported by science and data that can help with desire if you don't want one of the FDA-approved medications, and would be great then to use with a lubricant or moisturizer. Dipsy is for those of you who don't like to read or need trifocals like I do. You can listen to, yes, trifocals at 50, that was fun. But you can listen to stories, and they can be as nice or as naughty as you want them to be, like at your comfort level, so they meet you where you are. And that also bridges that like orgasm gap that we talk about, or that spontaneous versus responsive desire. Because people are like, how can I catch up to my partner? He's already there. I'm like, well, listen to the story 30 minutes before when, your partner's ready. And so there are some great innovations out there. And there's a little toolkit too that you can fill out, and they send you scenes, and then you can use products at home. So there's lots of options out there to get to your desired level of intimacy and sexual activity.
And vibrators too.
Vibrators are great, and they are actually been shown. We are talking about them at CME conferences, and they benefit not only all the domains of sexuality, libido, orgasm, arousal, but also help with that pelvic floor strength and health. So yes, I'm giving you an honorary MD, Naomi.
She's earned it.
Oh, what about, testosterone?
Yes.
Can you guys address that? Because I know it's controversial. Some people are on board and some aren't.
I mean, I'm a huge fan. Your ovaries naturally produce testosterone. They actually produce more testosterone than they do estrogen. We have about 1/10 of circulating testosterone as men, so we don't need as much. The reason it's controversial, well, there's a couple of reasons. There is no FDA-approved testosterone-only treatment option, but there are a global consensus statement. Very rarely do we globally agree on anything, and there's a global consensus statement supporting the use of testosterone for low libido, and the Menopause Society, formerly known as NAMS, also supports it. And testosterone helps us with libido and orgasm and arousal, but there's more and more data coming about testosterone helping us with muscle mass and bone density and reducing our risk of dementia and overall feeling of, we talked about being moody, but overall feeling of well-being and mental health. And so testosterone is just as important for women as it is for men.
One quick add-on is that I long for the day that testosterone no longer is a controlled substance, especially when it's used for the indication of low libido in women. There's absolutely no reason why it should be. And just real quick, because this just published or was just presented at the American Neurological Association, there's just a study of a large meta-analysis. This is not testosterone estrogen, but because it was mentioned, estrogen or hormone replacement started within 5 years of the onset of menopause actually may reduce your incidence of Alzheimer's disease. If you wait until after 65 to start, it actually can worsen your risk of Alzheimer's disease. So again, for the people who have apprehensions about hormone replacement in general, including estrogen, because there are still a lot of providers, in fact, who feel apprehensive about prescribing it, now you have yet another indication to prescribe it. So,
Fascinating. Thank you all. And I as you guys can see, these women could probably sit here all day and educate us 360 head to toe, scalp to vag, but unfortunately we're mostly out of time. I would like to see, are there any questions in the room? I'll take one or two, and if not, we'll wrap it. Yes?
Just because you're all very learned and smart, and I'm not. But what are some great phrases or keywords to use when we're talking to our doctors to get them to take us seriously to treat our symptoms, not just say, oh, that's typical of menopause. But that's what I get a lot.
Wow.
And the symptoms are not addressed.
in honor of Hispanic Heritage Month, because I am, in fact, a Latina. And everybody loves Bad Bunny nowadays. He has a song called Calladita. And a saying in Puerto Rico that we hear a lot is calladita te ves más bonita. If you're quiet, you look prettier, right? Don't be quiet. Like, you have to be a loudmouth. And I think using the term vital sign is actually probably really good. If you go to your doctor and you're like, I feel like there's a problem with my vital sign of sexual health, if they ignore you, you should sue them.
Energy is precious. You can tell I'm a Swiftie. Sorry, and her album didn't come out today.
New album today.
Yes, and I got up at 5 to listen to it. Yes, but she says energy is precious and don't waste it. So here's my thing. I see women who've come, and I'm their 9th doctor, because they've spent so much time trying to be seen and negotiate with someone. They're either trained or they're not trained. They're either going to be empathetic or they're not going to be empathetic. So either go on ISHWISH, the International Society for the Study of Women's Sexual Health, or the Menopause Society, and find a provider who is trained, and not only trained, but who has passion about it. Ask your friends about it. So half the battle is finding someone someone who knows what they're doing and who has passion about it. And then the third thing I will tell you is nobody, including me, knows your body better than you. And so if someone does not respect your point of view, because it's a partnership, right? I'm not dictating what you need to do. It's a partnership. Nobody knows your body better than you. So going in with that confidence and documenting your symptoms will also really help you get the outcome that you want.
Well, we are all marching out of here to put our doctors in their place and say, Dr. Javaid and Dr. Peña and Naomi Watts and Dr. Meston said so. But thank you all very much for being here. We're so appreciative of the time you've spent with us. Hope that you'll stay and shop and hang out, which is what we'll be doing for the rest of the day. So have a coffee and thank you for coming to the Meno Café.
Thank you.